Dental impressions are a great form of evidence because bite marks are individual evidence because they are unique to each person. And factors that contribute to the individuality of our teeth include the number of teeth, the size of the teeth, their color, the way they're aligned, any unique fillings, crowns, caps, the distance between the teeth, and their overall condition. If there's any, pitting or different shapes, chipping, anything like that would be unique to an individual person. And typically, as an older person, would, when if we were to look in their mouth, we would see a lot more unique fillings and breakage and caps and crowns versus somebody that's younger because they won't have as much damage typically to their teeth. But children's teeth actually might be discolored from antibiotics, so you have to be aware of that as well. Now, teeth are quite unique in the fact that they will withstand the heat from a fire, and that's because of the enamel. And this is a different spelling of it. You typically see an E here. But the enamel is the tough covering that protects the living dentine or dentin of the tooth, and the enamel is what gets damaged if you're eating a lot of acidic foods or doing other things. A lot of drugs will wear the enamel away as well, um, and stomach acid from throwing up. So the enamel is what protects the teeth, and this is actually what helps with the tooth withstand the heat of a fire. It's that strong. And then the dentine is the living part of the tooth. Um, then underneath that we have the pulp. The tooth is embedded in the gums, which surround the bone. And this long part of the tooth is the root. And then underneath, we would actually have nerves that go to the tooth, and we would have blood vessels in here as well. Now, when you feel pain or anything from cold, if you're eating ice cream, and that's because of the nerve. And when you have a root canal, you're looking at this part of the tooth here, the part that's embedded in the gums. And we actually have 20 primary teeth and 32 adult teeth, so we end up with more teeth as an adult. And it's important to understand when teeth come in because we can figure out somebody's age if we see remains. But remember that, teeth are only as good as the reference samples that we have to refer to. So if we don't have any dental records on file, we can have the x-rays, but we need to be able to match them to something in order to find an individual person. And when collecting bite impressions, you always, of course, want to take the photograph of the impression first with a scale, and then you're going to collect any saliva, which might contain some DNA, because, of course, when somebody bites somebody else, you might have, saliva on there, which would have DNA. So, teeth are great. We've already mentioned that they're good for identifying remains and, of course, suspects, using bite patterns. And there's lots of different points of comparison. We mentioned some of those, but there could be up to 76 points of comparison in an individual bite mark, including things like the angle of the mouth arch, the alignment of the teeth, the individual tooth dimensions, all right, and all of the conditions that we talked about before. And then we can look at the actual teeth themselves or the bite mark impression that's left. In the front, we have incisors, and those are used for cutting your food, and they're pretty much straight. Those come in around between ages 6 and 8, and they're in the very front. Okay, there are front 8 teeth, so you have 4 on top and then you have 4 on the bottom. The canines are those, dog-like teeth that we have on the side of the incisors. They're pointed. They're good for cutting and tearing. They come in around age 10 to 11, and we have 4 of them. The premolars, okay, are these teeth here next to the canines. We have 8 of those, and those are good for chewing and grinding. They come in also about 10 to 11. And then the molars, okay, of course, are used for chewing and grinding as well, towards the back of the mouth. And these come in between ages of 6 and 12. And we have 12 molars, but we also have third molars, or what's called the wisdom teeth. And if there's presence of wisdom teeth, or if they were removed, we know that the person is between the ages of 17 and 21 because that's about when they come in. So, those are unique as well. So just from a bite impression, not having the actual mouth to look at, but looking at the impression that these teeth leave, we can figure out a lot of information about what the individual's mouth looks like. And again, because of that, dental impressions are individual evidence.